elevated side plank on the wall. So grab a wall close to you. You're gonna have your forearm resting on the wall. Then you're gonna walk your legs out. So a little bit you can play around with what feels best in terms of where your elbow is positioned, but the farther your legs are away from your body, the harder it's gonna be. I like to cross my legs to start here, or you can kind of bring one foot out. You can even bend that knee if it feels really challenging. But having your feet kind of crossed or more like that is going to be a little bit easier than having your feet stacked on top of each other. So do what feels right and best for you. I also like to think of slightly bringing this top rib down and in towards your opposite hip here. That's going to help you just lean ever so slightly forward to engage more of the obliques, rather than I find some people tend to kind of sink back and they end up using their back more than their abs and obliques. And the goal here is to train those obliques. So then you're gonna work on your breathing while you're in this position. So you're holding, inhale, expand your rib cage 360 degrees. Good to place your hand here. Exhale, pull hip bones together to engage those deep abdominal muscles. Feel those obliques working here. And then hold that and keep inhaling and exhaling. Okay, so then what you can do if you're concerned about doming, or just if this is too much pressure, you can feel along your midline, make sure you're getting good tension. You can watch for any doming or bulging. You can kind of take a look, see what's going on, see how your core is doing, and then feel for what the tissue feels like. So if you feel any doming, kind of that, you know, you're flat here and then you see a little bit of a dome or bulge, if you're feeling or seeing any of that and it feels really firm to the touch, then you may not be ready for that particular exercise, or in this case, this side plank. So continue to work on your deep breathing and side lying and standing and all these different positions and work your way up to this. If this is too easy, then we can make this harder by progressing to a lower surface. So play around with both sides, see what feels best with your foot position. Make sure you maintain that good deep breathing pattern. Check out what's going on with your core. See if there's any doming, or if you're having any pressure or heaviness in the pelvic floor, that may mean you need to modify. But if you have any questions about that, reach out. And then if you feel like one side is a lot more challenging than the other, you likely need to spend more time on that side. So maybe do an extra set or two on the side that feels more challenging, especially because it's very common to have muscle imbalances, especially if you're holding a child or toddler, you know, on one hip more than the other, which is also very common. So make sure you try both sides, maintain that good deep breathing pattern, and start to strengthen those obliques.